Hello everyone. How is everyone doing today? Hope you're all doing fine. So I've just been going through social media and I'm beginning to observe a trend. I don't know if a number of you have noticed that as well. We are starting to have many people come out stating that they've come down with many chronic illnesses, kidney diseases, some that have even required amputation of the leg, kidney diseases, heart diseases, very chronic and disturbing illnesses. So I've been observing a number of them, and there's a common factor I've observed, and that is many of these people had one disease in common, and that's diabetes. Poorly controlled blood sugar. I've noticed that it's common in many of these illnesses that people have of recent come out to state that they've had. Thanks for hanging out. I'm one of the doctors who believes that preventive medicine has a very, very imperative role. It's very important in prevention of development of chronic disease. For people who have come down with these diseases, there's still a way out. There are many things you can do if you've got the proper information. So that's what we do on this channel, give people the right information. All right, so what is really diabetes? I've had lots of things. Okay, some people say diabetes is caused when you take lots of sugar in your diet. In their own sense, they may be right, but diabetes is a bit more than that. Now we need to understand what happens in diabetes. And one of the nicknames we have for diabetes is called hunger in the midst of plenty. So we always want to describe it as lacking when you have so much. So what happens? The blood has so much sugar, which produces energy. But the vital organs that need this energy from the sugar don't get them. So the sugar is just there in the bloodstream, but the brain, the muscles, the bone, the vital tissues that need the energy from the sugar don't get them. So the sugar is just there circulating on its own, but it's not getting into them. So what happens? There is a chemical in the body. It's called insulin. It comes, drives this blood sugar into the vital organs, so these organs can benefit from them. It's as simple as that. So what happens in diabetes is that the blood sugar is just high in the blood but never gets to the organs, and that's what's resulting in all the symptoms and complications that people come down with. Now it's all about either a lack of insulin that should drive this blood sugar into the vital organs, or the presence of insulin but it's not functional. So it's not just about taking lots of sugary things and all that. Yes, it's quite important to avoid taking lots of sugary things, because if one already has diabetes, it can make these symptoms worse, but is not the real cause of diabetes. Now, what are the things you need to look out for that could point to the development of diabetes? Number one, if you notice that you're losing lots of weight despite having an adequate diet, then it could be one of the symptoms of diabetes. Because remember, we said the blood sugar is very high, but these organs are not getting them. Okay, the other symptoms you can look out for is when you're getting tired easily. So the blood sugar is there, it's not giving you the energy that you need, so you get tired easily. Okay, previously you could walk from here 2 streets after your house, but now you just walk, you get to your gate or you get to your street and then you're already getting tired. That should be a pointer to something that could be happening, that it's not quite right. You're beginning to take water a lot, more than you will take, significantly more than you will take in the past. Okay, this is one of the symptoms of diabetes. Okay, so you're beginning to pass urine quite frequently, frequent urination, one of the signs of diabetes. Now, because diabetes affects your body's ability to fight infections, one of the symptoms are genital infections, so vaginal discharge, and ulcers in the penis, abnormal discharge from the penis, anything that has to do with genitals could be one of the symptoms of diabetes. Okay, diabetes also affects the eyes, so the vision is not clear. So if the vision is not clear, it could be one of the pointers as well. Now, the thing to note with diabetes is that diabetes can affect any organ in the body. It can affect the eyes, it can affect fertility, affect sexual function. One of the major causes of poor sexual function in men. Okay, so someone is saying, I don't want to be on drugs for life. If they diagnose diabetes, I'm going to be on medications or I'm going to be on injections. Okay, a very significant percentage of people with diabetes are controlling it with just diet. Okay, so the fact that diabetes has been diagnosed doesn't mean that the person is going to be placed on medications or injections. If medications or injections are required, yes, your doctor is going to suggest this to you, and they are quite tolerable. They help to control diabetes, and when it's properly controlled, it hardly leads to complications. Most of the complications of diabetes are due to poor control of the blood sugar over a long time. So it's worthy of note, whatever your doctor suggests, whether medications, whether diets, whether injections, they are all tailored to proper control of your blood sugar. So that's it, everyone. Check yourself for some of these symptoms. If you have any of them, you can visit the hospital and then get yourself checked. It doesn't take long, 30 seconds, less than a minute, you can do a diabetes check. Thanks for hanging with me today. Don't forget to subscribe, like, and share to as many people so that we can all learn together. Thank you. Bye.